We're spoiled in multiple myeloma in the sense that we now have more choices than ever before. This disease tragically still remains, generally speaking, incurable, but we have more options to treat patients than ever before. Patients are living longer, and in many ways they're living better because of these novel therapies. But I can't pretend to know exactly what a patient wants or needs. And so it's important for me to engage that patient in the dialogue. This whole concept of shared decision making isn't just a feel-good phenomenon. It really is a critical part of what we do. So to answer the question of how this is integrated into practice, this should be an essential part of how we communicate with our patients. We don't look to our patients and say, you'll take it and you'll like it. Of course, we never do that. But it's the concept of saying, let's look at all of the options, what they entail, and let's match that to the preferences of the patient. What is really valuable to the patient? I just had a conversation with a patient last week who is a race car driver, who has very careful requirements for his job that he wants to maintain on therapy. So how do I match that to the patient? Whether they prefer an oral regimen, whether they wish to travel less in and out of the clinic, whether certain toxicities sit well with them versus others that may not sit well with them. Now that we have that choice, I think it's more incumbent on us as myeloma providers than ever before to sit down with the patient and, most importantly, to value them. I say it all the time without trying to be moot. I don't treat myeloma, I treat people. And when I look at that patient across from me as an individual who has a preference, who has a choice, and I value that choice, often it lands us in the best place for that patient.